If you have not approached the menopause yet, then save this video for later. Let's talk about the sexy things when it comes to the menopause. I'm Dr. Nagat and the author of The Knowledge, your guide to female health from menstruation to the menopause. I know I discuss a lot of things about perimenopause or menopause and postmenopause, and some of you have said to me, it all sounds doom and gloom. I'm here to tell you that that's not the case. I know every woman has her own unique experience, and there are of course both physical and psychological challenges women can face during menopause. And now I'm going to talk about the most common ones that I hear. Many of us may also have some preconceived ideas about sex and menopause, so let's break that taboo now in this video and talk about the most common ones that I come across. Number 1, reduced sex drive. That's not true. In a study published in the journal Menopause, sexual desire was examined in women during and after menopause. The research found that surprisingly, majority of the women in the study reported an increase in sexual desire. This change was associated with several factors, including reduced fear of unwanted pregnancy and increased sexual confidence, and the results suggested that menopause does not necessarily mean a decline in sexual desire and can actually lead to a newfound freedom and openness to sexual pleasure. Number 2, sex will be painful in menopause. This is something I hear a lot of women talk about. One tip I can give you is please start using vaginal moisturizers such as this in your 20s, 30s and 40s. Yes, it's never too early to start thinking about your vulval health. Self-examination of the vulva should start in your teens, effectively moisturizing the mucosal membranes of the vulva internally and the vagina internally over time stimulates the growth of cells in the surface layer of the skin mucosa membrane and restores pH, making intercourse comfortable. Then in perimenopause, if you have vaginal atrophy or genitourinary syndrome of the menopause symptoms such as vaginal dryness, overproduction of watery discharge, pain on having a smear, an itch that doesn't go away, and this helps restore the estrogen back in the vulval vaginal area. Number 3, the notion that women become physically unattractive in the menopause. Now, this is an idea that I hear bashed around a lot on socials, and it's an absolute myth. Think again. Attraction has no best before day, and it's high time we threw this prejudice out the window. Women of all ages can be stunningly beautiful and seductive. Age is just a number, and attractiveness is foremost about confidence and charisma. In fact, research published in Psychology of Women Quarterly found that many women experience improved self-esteem and increased comfort with their bodies after the age of 50 because you find your sense of self. Number 4, one common question is whether menopausal women experience changes in their ability to achieve orgasm. There is no clear conclusive evidence as to whether it takes longer for a menopausal woman to reach orgasm. Some women may experience changes in sensitivity or arousal due to hormonal changes, while others may not notice any changes at all. Menopause has traditionally been surrounded by so many preconceived notions, many of them are negative than positive. And I hate this idea that the more sex that you have in the perimenopausal, menopausal phase, the better it'll be for a woman. She just has to like it or lump it, that use it or lose it analogy. That is an utter myth, but there are so many things that we can do to support a woman at this stage in her life. So when it comes to sexual pleasure and orgasm, menopause can actually be a time for increased insight, freedom, and pleasure. So, you see, menopause doesn't necessarily mean that sexual pleasure and orgasms just disappear. On the contrary, many women experience increased sexual satisfaction and intensity in their orgasmic experience. So yeah, save this video for later. Bye.